My name is Sir Keith Ejegbo. The reason I'm here and the reason I need a hip replacement is that I was a serious tennis player. I was a very good junior tennis player, then kept playing at county level. And tennis was incredibly important to me, I think, in terms of my life. So when I've retired, I've probably played even more. So I've kept playing a lot. And it was last June, I suddenly realized I was getting a pain in my hip. And I know that lots of tennis players have problems with their hips, so I was a bit worried about it. And I saw Professor Field relatively early on, and it seemed then as if it was quite mild, and that I just have to sort of moderate how much I played. Then in December, I was playing a doubles, and it hurt a bit more. And then I had an X-ray a few days after, and I realized that it had fractured. And then I was in some pain. And when I came back to see Professor Field, he then said that basically the hip was shot, that it wouldn't repair, and that I needed a hip replacement. I mean, obviously I'm worried about how long it will take me to recover. I want to be back walking, obviously as quickly as possible. I just wondered.
Well, you will be able to walk straight after the surgery. It will take a few hours for you to actually recover from the anesthetic, but then after that you can put as much weight as you want on the leg, so you can walk normally.
And would I go back to doing physio and stuff? Or?
Yeah, so you will have physio whilst you're here in the hospital. Basically, we will want you to use 1 or 2 crutches just to correct your gait, but because after the surgery you can put the amount of weight you want on the leg, and it's absolutely safe to do so. And your muscles will all be working because they're spared, they're not cut during the surgery. But you will have a little bit of soreness, and you will also have muscle memory from the condition, from the pain you're experiencing now. So we're kind of going to work on correcting that a little bit. And we will check that you are safe moving about, walking and doing stairs and doing the exercises, so you can continue them at home. But that's all you'll need from us, so we can get you home the day after the surgery.
My name is Richard Field. I'm an orthopaedic surgeon specialising mostly in hip surgery, and I undertake my practice at the Lister Hospital in Chelsea. Hip surgery has been going since about 1870, and in the early days of hip surgery the operations were all really just to drain infected hips with TB and injuries from conflicts and wars and shrapnel, those kind of problems. In the 1960s, hip replacement was introduced, and it's an operation that's become more and more common with every year that's gone by. We now have about 90,000 hip replacements undertaken every year in the UK. And there's lots of different ways of doing a hip replacement, and lots of different types of hip replacements are used by different surgeons for different reasons. I was appointed as a consultant at St Helier Hospital in 1995, and then moved to the South West London Elective Orthopaedic Centre when it opened in 2004. I've been the Director of Research there since the hospital opened. In the course of my career, I've done about 5,000 hip replacements, and for the last 10 years or so, I've done these operations using a technique known as the anterior approach, which I learned from a French surgeon in Paris called Frédéric Lode. And he developed a technique known as the Amis technique, which is the one I prefer to use. But there are a number of different ways the operation can be done. We've done almost 2,000 primary hip replacements using the Amis technique, and in the vast majority of cases the results are really quite outstanding. We see patients getting better quicker with the Amis technique, and while the long-term result isn't really any different, and by a year I wouldn't expect to see any difference whatever technique is used, it does steal less of the patient's life. It generally allows them to get back to being themselves a little more quickly, and most people seem to be rather grateful for that. The potential advantage of anterior approach hip replacement, which is an Amis technique, is an example of this, is that because there's less disruption to the soft tissue envelope around the joint, patients walk without aid more quickly, they're able to swing their leg out of bed more easily without support, and they're back to looking after themselves and activities of daily living a little more quickly. Some of them say that it's a less painful technique, and I have operated on patients who years ago I'd done a posterior approach and then I do an anterior approach, and they say that it's like chalk and cheese. So clearly some patients seem to appreciate the difference.
The next day, I feel fine. I mean, I've already done a series of exercises moving my leg. I've been out in the corridor, walking up and down the corridor, initially on 2 crutches, then on 1 crutch, learning how to walk without a limp, then on a stick, and finally walking actually really well, given it's the next day, without a stick at all. I've also climbed the stairs, and I can climb the stairs unaided without sticks as long as I hold on to the banister. So given that yesterday I had the operation, I feel it's incredible that now I'm on my way back. Obviously I've got to take it easily and listen to the physio, but I imagine now that I will get back to playing tennis hopefully in 3 or 4 months. So I'm really, really pleased.